chorea. So chorea is a condition wherein there is repetitive irregular movements which can appear like the person is, if the patient is walking, it will be like the patient is dancing, or fidgety or restlessness. So if you keep the hands like this, you will have a very slow abnormal movement which is repetitive in nature, irregular. Sometimes the patient can control it, and these can occur as a result of different diseases, underlying diseases, and the classical example being Huntington disease, where the patient can have chorea, generalized chorea, and they can have, this is a genetically mediated disorder, and the patients can have, apart from chorea, memory problem, dementia. You can have, these conditions can also be seen in diseases known as chorioacanthocytosis. These are all genetically mediated. Sometimes the chorea can be a part of a infection, post-infection, what is known as streptococcal infection, what is known as Sydenham's chorea or rheumatic chorea. A child can have sore throat. So sore throat, recurrent sore throat sometimes can be caused by streptococcal infection, and if it is not treated properly, later on these children can have what is known as Sydenham's or rheumatic chorea. So it is very important to consult the doctor when a patient has these problems. Let us see an example. Here you can see this, just to show that these hands are irregular movements are going on. In the faces, these movements are also going on. You can have a movement in the tongue, the legs, and the patient's muscle tone is actually reduced. And you can see when the patient is walking, there is slightly broad base, as well as there is jerky movements of the fingers and the toes, and sometimes they have difficulty in turning. It can be sometimes very violent, and there are again treatment for these conditions. Though it fully treat the underlying condition, it can definitely control these abnormal movements. Then there is an extreme form of chorea, sometimes known as ballism. There is a flinging movement of the hand. So this can occur because of certain conditions in the opposite side of the brain, like stroke, or because of family conditions. So you can see here this can be very, very disabling, and patient needs to be admitted in the hospital. Treatment has to be instituted, and sometimes a surgical treatment may be needed for this patient. So this is a patient having hemiballism.